Spaulding is a remarkable environment. It is a family. It is innovation. It is passion. It is academic thoughtfulness, and most of all, it's a learning to care for patients. And training at Spaulding transforms a young person's life and makes them a leader.
And they get such a rich and diverse experience that they will feel comfortable practicing in any setting once they've been through our program.
One of the things that makes the Spaulding environment so unique really is our teaching mission. And it's the residents, the fellows, our students in nursing and in all of the rehab disciplines, PTOT and speech, based on that inquisitive, always asking more and more and more. How do we learn? How do we do things better? And this is an environment where that happens.
PGY 4 years, mainly outpatient, so your typical day will vary from site to site across the city. That can include sports medicine, pain medicine, general neuro outpatient type rehab, and you're doing various procedures at each one of those different sites. With each site here, which is nice, kind of specializing in more niche procedures, so shockwave therapy, lumbar spine injections, platelet-rich plasma, regenerative medicine type stuff, in addition to your spasticity things like Botox.
The people here really make Spaulding what it is. So the therapists here are absolutely fabulous. They love having us come and watch them do sessions with patients. So a typical day at Spaulding, especially as a first-year resident, you're mostly in-house here at Spaulding, so in our kind of freestanding rehab hospital. So we have 4 floors you typically work on. We also have a pediatric floor, but a stroke floor, kind of a burn complex rehab floor, a spinal cord injury floor, and a traumatic brain injury floor.
I think our brain injury fellowship is among the finest in the country or the world. Part of the reason for that is the broad programs that we have. A remarkable effort in concussion, military-related concussion, sport concussion, those with more severe injury, outpatient, neuroimaging, understanding of pathologic mechanisms, spasticity-based treatments, and really one of our areas of real interest, disorders of consciousness.
So the fellows spend, more than about half of their fellowship at the VA, in the Spinal Cord Injury Center at the VA. And at the VA, they're not just working with this great faculty, they also have a really strong interprofessional team, ranging from working with adaptive sports, working with, going to wheelchairs and seating clinic, drivers training programs.
Like we saw in the x-ray that we got earlier.
No matter what it is that you are seeking to be for your career, you'll be able to find it here, whether you want to be a generalist or a specialist. We can provide the training for you so that you will come out either well-positioned to get a fellowship or a job, which marks the future leaders of our field. We have in our residency 4 electives, which are each a month long. For those electives, you get 2 in your PGY 3 year and 2 in your PGY 4 year. Our elective strategy is that you can do whatever you would like anywhere in the world.
The multidisciplinary approach, the team-based approach, working across disciplines is really inherent to sports medicine. When we have thought in the past about our fellowship mission, our vision statement, our primary objective is to train the highest level academic sports medicine physicians to ultimately be leaders in the field.
The clinical education piece is there, the research piece is there with just incredible amounts of opportunity through Spaulding, through Harvard Medical School, through Mass General Brigham, as well as the clinical education piece. And I think that has just been one of my favorite things about this program. This program trains sports medicine clinicians, and my experience in the training rooms and on the sidelines in musculoskeletal clinics has just been incredibly invaluable for me.
Okay, so come all the way laterally, and let's see, showing that fascial plane.
From my practice in the sports world, it's pretty uncommon for a week to pass when I don't walk across the hall and chat with some of the therapists face-to-face about some of our mutual patients, and I always bring the residents along with us. We try to underline that, the importance of that communication. Being part of a team here at Spaulding is more than just kind of something that's done. It's really tied into the fabric of how we train our residents.
So our fellows get to rotate through multiple different hospital systems. They rotate through Spaulding Rehabilitation Hospital. They rotate through Massachusetts General Hospital. They rotate through Boston Children's Hospital. And with all those experiences, they learn outpatient, interdisciplinary clinics, consults, inpatient, research, injections, so a little bit of everything. So we have a number of faculty that are actively engaged in research projects, and so fellows may choose to take part in one of those research projects, or fellows may come in and decide that they want to start their own research project and use the great mentorship that we have amongst our faculty.
We ask that all the residents get involved in research. And during the first year, the PGY2 year, they choose a research mentor and pick a research study question and maybe start getting going with the research project, submit to the IRB. In the second year, they get involved in the data collection. In the third year, we're hoping that they will then put together a manuscript and a presentation at a meeting so that they have the opportunity to consider making research part of their career, better understand the research process, and better be able to critically evaluate the research literature.
Our overall mission is to get one day better every day for our patients. Our overall mission is to transform the lives of people we care for. Our passion is training the next generation of leaders, so the people who do the best are the people who want to lead.
As we welcome our class of residents and fellows each year, we welcome them to become part of our community, our Spaulding family.
I am Harvard PM&R.
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 I am a Harvard PM&R.
I am Harvard PM&R.